Hey there, and welcome to part two of the Functional Medicine Exposure and Discovery series. In this video, in part two, we're going to go through how we evaluate the root cause of your health concerns. So, really going to expose the science behind personalized medicine and how functional medicine initially in our system evaluates a particular case. So just a little bit of a recap. In part one, we talked about the difference between allopathic and functional medicine and the models, the comparison contrast. What I did is I put this illustration in here. What this illustration does demonstrate is it really demonstrates a nice differentiation between the disease processes that we see above the surface here. So you can see that this tree is growing, and we have different labels of disease processes. But underneath the surface here, as the soil would be for a tree and the roots, these are the causes. And this is really where functional medicine lies, is underneath the surface, where we're identifying and exposing the root causes to these particular diseases, health challenges, health concerns, wherever you fit into those categories. And the design here then is to address the root causes. So in our functional medicine evaluation process, we go through an initial process and then a secondary process, which is a deeper dive, or digging deeper into and finding and exposing the root causes, because digging deeper into these root causes will accelerate your outcomes. That's really the bottom line of it. So why traditional testing falls short? And really at this point, we're just going to pick on blood testing because it's the easiest thing to understand, number one. Number two, it's the first thing that we're going to do from an objective side. We're going to look underneath the hood in your body and understand how your body is functioning from a blood chemistry standpoint before we dig any deeper. So a couple of differences here and why our blood testing, well, traditional testing falls short in identifying root causes for problems. First and foremost is standard blood tests only check for disease states. And so if you get a blood test from Quest or LabCorp, you get these tests from your practitioner. I'm going to show you here in a second the difference between what a range is versus an optimal or a functional range. All right. Number two, okay, we are looking at the often missed imbalances that occur before disease develops. So we're taking these markers and we're saying, okay, they're fine, they're within range, there's nothing going on, we're not identifying any risk factors. On the outside chance that they are, then comes into the label of disease processes. So for instance, type 2 diabetes. If your blood sugar is way off the chart, if your A1C is above what they would call a range for non-diabetic or pre-diabetic, you're going to get labeled and diagnosed with type 2 diabetes. And then what happens is the course of care in the medicinal model, which is blood sugar lowering medications, and the list goes on. So with a functional blood chemistry analysis, we're not going to miss imbalances and collective imbalances to understand the development of a challenge of a problem before actual label of a disease. Last but not least, so functional medicine looks at patterns, trends, and dysfunctions to prevent and reverse health issues. So I want to give you some demonstrations of this. First and foremost, when we look at the difference between, and I'm just taking this as a reference in the thyroid system, but what I want to focus on here is the difference between what the reference range is and the functional range. So when you take a test at, let's say, LabCorp or Quest, you're going to get a reference range. And what that reference range and how that reference range is developed is everybody that takes the test at a Quest, let's say there's 40,000 people, 50,000 people, that take the same test at a Quest location. They're going to take the mean. So they're going to take the average of everybody's test score, okay, marker score, and they're going to create that as your mean. And then what's going to happen is they're going to make a first and a second standard deviation. So that becomes your reference range away from the average of everybody that's taken the test. The difference here is a functional range. Now, a functional range in functional medicine, functional blood chemistry, is to identify a very specific reason why that marker should be within that range and what it means if it's above or below that range. So these are very studied and concise ranges for these particular markers. And again, I'm just referencing thyroid right here. However, this does apply to almost all markers within your blood chemistry panel. Moving forward here, then what we're looking at is we can identify patterns and trends, and this might be, let's see, it might be a little small, but what we're looking at here, let me try and enlarge this for you. What we're looking at here is we can identify what that current test looks like. That's a baseline, and then we can see how things change over time, so we can shift and maneuver with that, support the strategy that's needed, if you will. So we like to use a baseline, and we like to continue to compare to baseline to see your patterns and trends over time. All right, last but not least here is when we're looking at this blood chemistry analysis, we're looking at again, your functional range. And with a functional blood chemistry analysis, we can look at the optimal range and the standard range, as well as if this is above or below standard, or highly above or highly below standards. And so within this particular blood report, then those are marked, and then we can see and identify exactly what's going on and what that means. So it's much different than just getting your test and being like, okay, it's in or out of reference range. We get to analyze each marker specifically. We get to put these markers into collections and understand what a particular body system is doing. And now I get to show you exactly how that equates to the evaluation. So putting that on hold, now going into what we would do as an initial two-step functional medicine evaluation is first we're going to identify subjective response. So we use a functional health assessment. This is about a 320 question symptom survey analyzing gut health, inflammation, hormones, metabolism, and it helps us identify exactly what's out of balance. So a particular patient in this situation would fill out this survey, and it's a subjective survey, so they're just measuring their responses to certain questions that are being asked. So within this, then, you can see that we are analyzing all 15 body systems. We're analyzing all 15 body systems, and with the score that is taken on that, we can look and identify if this is a low, moderate, or high priority. So everybody's symptoms are subjective to themselves and what they experience. However, we can look and create a collection of areas here. So we can see that right down here, this is your gastrointestinal system, which is upper GI, liver, small intestine, large intestine. And if we have a high symptom burden in here, we know that there's some gut issues, so there's gut dysfunction from a subjective side. We can also look at nutrient deficiencies from a symptomatic side. Then we get into the endocrine system or your hormones. So we're looking at stress. We're looking at pituitary, which is the commander of all of your hormone glands. Looking at thyroid, and then we can differentiate the difference between men and women. And then last but not least is some of your standalone systems here: cardiovascular, kidney, bladder, and immune system. So this symptom burden gives us a really good idea of where you're housing a lot of the symptoms that we can correlate with a functional blood chemistry evaluation. And that leads us then to our second step here, which is the functional blood chemistry, which we get the same blood as anybody else. It's just that we're going to evaluate this in an advanced way. So we're going to look at the biomarkers in a different way, in a deeper way than traditional lab work. And what we're going to look at is we're going to look at out of functional range markers. We're going to look at the functional body systems, so a collection of these markers that correlates with how that particular system might be functioning, the probability of dysfunction, and then we can collect a handful of nutrient deficiencies off of blood chemistry. And so some of the visuals that I wanted to show you here in this particular situation is when we look at this, when I create a report, we see these optimal ranges for these specified markers, and this goes all the way through the markers that have been run for a particular blood test, just as an example here. You can definitely see the ones that will be in optimal ranges and the reasons why, and then we can identify the ones that are well below optimal or well below standard, as you can see just as an illustration here on different ones. And then what we can do is we can look at and see what that marker means, what it's what it's measuring, and then ultimately, like I said, putting it into the collective bucket for that particular system. And if that marker is off, what that can mean for system dysfunction. The next one here then is when we look at the functional body systems details, then here's that collection of markers there that can correlate with saying, hey, there's probably some gastrointestinal dysfunction or there's some liver dysfunction based on those markers being above or below optimal or standard. And that would be the next line of, okay, we're getting to understand, we're whittling down where your dysfunctions might be lying. So that's really the cool second part of this blood evaluation. Then what we're doing ultimately with blood is we're turning possibilities into probabilities. So when we collect the blood evaluation and we look at the markers and we identify the ones that are outside of optimal range, whether it's above or below, we get to put those markers in these specific buckets, and then we can say there's probably thyroid function, there's probably blood sugar regulation challenges, cardiovascular, kidney, and you can see just in this representation here which ones came back as the highest as far as it's probably happening in that particular system. Then this information, along with that subjective test, the health survey, gives us an idea of what we need to concentrate on and gets to rule out what we don't need to concentrate on. For instance, in this situation, it would be liver function or adrenal function that, hey, this isn't coming in high or dysfunctional. You're not creating a high symptom burden on that. So this isn't a system that we need to pay particular attention to. And again, this is all based on your goals. This is all based on what you want to achieve and utilize this system for. And then last but not least, we can look at individual nutrient deficiencies in a blood test like this. Now, one thing that I will say is that there's only a handful of nutrient deficiencies that we can truly measure on blood evaluation, like vitamin D, sometimes vitamin B, some of your other basic vitamins, but it's not going to go into depth into every vitamin deficiency that you need. The biggest difference, and going on a little tangent here, is that most of our blood evaluation is being measured what's in the serum, what's running around in the bloodstream. But the other marker that is important to understand is inside of the cell. So we know what's running around in the bloodstream, but we also want to know what's going on inside of the cell. And that's just going into a deeper evaluation strategy to find those out. However, this does a very good job of giving us an indication on what might be deficient and what might be supported if we stop here and just say, here's some of the supplements, here's some of the deficiencies that you have, and we can work into a treatment strategy. All right, so ultimately, what do we uncover with this initial evaluation? Well, first, clinical dysfunction, and not a disease process, as I have stated before, but where are the dysfunctions? Where could the root causes to a certain situation might be lying? All right, and it also creates a hierarchy of needs. So we're looking at chronic inflammation markers. We're looking for hormone imbalances. We're looking for blood sugar and insulin resistance. We're looking at nutrient deficiencies, and we're ultimately looking at metabolic function and the hierarchy of needs. The highest and the top in the hierarchy is gut health. And so what does this look like? Well, I'll give you a couple of illustrations here. Okay, when we're turning possibilities into probabilities, we have this iceberg annotation here. Number one, just like the tree, the symptoms are above the surface. So this is what we can see, we can feel, we can understand. But what we don't see, feel, and understand is the specific causes that are creating those symptoms. And those lie in these different systems or within these different challenges. So toxicity, inflammation, hormonal imbalance, immune imbalance, stealth infections, nutrient deficiencies, ultimately stress. So those are the things that we're looking for with the blood chemistry, with the health survey. We're turning possibilities into probabilities so we can concentrate on the things that might be going on and rule out the things that are not going on, and we don't have to spend time or energy or even money on those. And then last but not least, going down here, let me go this way. Our report can give us a breakdown of clinical dysfunctions. So once we get a blood chemistry analysis, we throw it through this report not only are we getting possibilities and probabilities or nutrient deficiencies, individual markers, what they mean, then we're going to look at specific health concerns. So clinical dysfunctions in this particular situation, as a reference, hypoglycemia or biliary insufficiency, metabolic syndrome, dysglycemia, so glycemic imbalance, and anterior pituitary dysfunction. And like, well, how'd you come up with this? Again, blood can be very intricate, and when you put a collection of these markers together, you can come up with these dysfunctions. And again, we're not chasing the disease process, and we're not even labeling a disease. We're looking at the possible dysfunctions that might be driving a disease process. And when you identify these and when you clear them out, that's when things metabolically change, biochemically change in your body. And so why does this matter? Well, I'll go back to this illustration here that I used at the beginning. Traditional medicine waits for the disease process. It's reactive, whereas functional medicine acts before you develop a chronic condition, because we're looking underneath the hood, trying to identify the root causes to the specific challenges that you might be dealing with, whether it's weight gain, lack of energy, hormonal imbalance. The list goes on. There's no one specific thing that this is perfect for, and there's no one specific thing that this cannot address. It's all based on what you want to achieve in your health journey as you move through your years. All right. So, and last but not least, by identifying these balances early, we can prevent and reverse health concerns naturally. So if we go back to that initial part one, and I said, who is this for? Well, the DIYers. The more that you understand what's going on underneath the hood, the more that you can specify and personalize the healthcare strategies that you do, whether it's a supplement strategy, the supplements that you take, the nutrition, the diet that you participate in. But I'm saying the more information that you can gather on yourself by going through this initial evaluation, the better that you can be. Now, those with symptoms, okay, they're chasing symptoms, or those with actual diagnosed disease processes, it still works the same. We're digging underneath the hood to find those root causes. And when we can identify those root causes and we can specify the treatment plans, whether they're supplemental, nutritional, lifestyle, you can support your the reversal process and achieve the goals that you're looking to achieve much easier in an accelerated fashion versus just guessing at what to do or doing nothing. All right, looking ahead in part 3, I'm going to discuss how we use nutrition, how we use supplementation, and how we implement lifestyle changes to build a customized plan based on the data that we collect. So stay tuned for that, and I will speak with you soon. Bye for now.